One of my favorite quotes is by Mahatma Gandhi, and he said the best way to find yourself is to lose yourself in the service of others. This has been an amazing conversation, one that is absolutely necessary and so important for the overall health of our community. I am ardent about this work and the impact that it has on our community at large. I tell you all today to be encouraged, stay encouraged, and keep up all of the amazing work. Keep having these necessary conversations, keep advocating for one another, and keep advocating for yourselves. We may be cautiously optimistic regarding the current COVID trends, but we know that there is still work to be done to eliminate biases in healthcare for an increased health equity for the community. So thank you so much. It has been a pleasure to serve and to be here today. So thank you.
We are moving in the right direction with seeing our COVID case numbers going down, but we're still in a pandemic. We're moving in the right direction though, but we need to stay on our guard. We need to continue to wash our hands, have our mask on, stay safe, get vaccinated if you are eligible, still do those things to stay safe, because even though the counts are going down, even one death among anyone in here or anyone in our families, that's too many. And so I want everyone to stay safe. So keep up the good work with keeping up public health practice. The other thing, please, call to action, take care of your social, emotional, and your mental well-being. There are many people that are predicting that the second pandemic is getting ready to be a wave of unprecedented mental health concerns. When you talk about post-traumatic stress syndrome, we can't even heal from that right now because we're still living in the trauma. And so once COVID passes, there's some predictions that there's going to be a lot of increased mental health overdoses, different issues. We're already seeing suicidal ideation among teen girls go up. Our overdose rate in Wisconsin is up 34%. Take care of yourselves and check on someone else. Check on others and check on yourselves every single day. Be kind to yourself. And then the last call to action is let's challenge our healthcare systems, public health systems, all the systems that have contributed to some of the inequities we see. Let's tell them to keep that same energy. After COVID dies down, how much money, how much emphasis, how much attention, all this anti-racism action that's going on after George Floyd's murder, after all these COVID inequities, once that dies down, I want people to keep that same energy as we move forward and we challenge and we tackle a lot of the health inequities that we've been raising our voice about for the last several years.
Keep that same energy. Yes. So for those of us who are here, who are representing systems, know that it is our responsibility. The onus is upon us to go above and beyond in repairing or in building trust. It is our responsibility. We carry a bigger burden. People have been working, decrying, pointing out these disparities for all of the last millennium, and it's been our failure. So we either get this right now or we're going to face this again when the next pandemic happens. The second thing I will encourage those of us Black folks who are here, those of us who are working in systems, those of us who are just community members, like I would encourage us to be open, to stay vigilant, but we also have to be open. And so being willing to have conversations, to be willing to talk to people that we trust who have made a slightly different decision on their healthcare than we have had, to come to a better understanding of why alternative decisions may have been made. I think that it is going to be a combination of continuing to hold these systems accountable and us doing the hard work of repairing and rebuilding trust, and also for us to be more open and to create some space for grace and understanding so that we can combat these issues together.